positive results in many health problems such as back pains, shoulder pains, migraine headaches, pain in the knees and legs, poor circulation, arthritis, diabetic neuropathy, numbness in the feet, strokes and sports injuries. ICT, repairs, rebuild, the power to heal, the future of pain relief. Why are you suffering from aches, pains and illnesses? When there's help for you. At Health Service Center, we offer a wide range of treatment that has been scientifically proven to help you with your aches, pains and illnesses. Our ICT machine is one of the most effective devices in the health field. It has shown positive results in many health problems such as back pains, shoulder pains, migraine headaches, pain in the knees and legs, poor circulation, arthritis, diabetic neuropathy, numbness in the feet, strokes and sports injuries. ICT, repairs, rebuild, the power to heal, the future of pain relief.
Good morning and welcome to another episode of PHI Public Health Insider. I am your host Jade Brown, and it is my esteemed pleasure to welcome to the show our Minister for Health, Wellness and Elderly Affairs, also the Parliamentary Representative for Vieux North, Honorable Moses Shabatis. Welcome to the show once again.
Good morning, Jade. Good morning, everyone. I hope everyone is well. I know everyone is preparing for Journée Créole and so on, but I'm very happy to be here. Always excited to discuss matters of health.
Yes, excellent. Now, those of you who follow PHI would know that Minister was our second guest when we first started off about a year ago now, and then we spoke about his ideas and the policy decisions being made by the government of St. Lucia as it pertains to health, specifically the St. Jude Hospital reconstruction project and universal health coverage. At that point, Minister, we hadn't really launched UHC as yet. PBF hadn't been launched as yet, but what we noticed and what we saw was that the government of St. Lucia had a plan. They had a plan to really execute, and they entrusted that plan to a team headed by Dr. Alicia Eugene Ford. Let's talk about the journey of UHC from that point, inception, to now, because it is about a year later. Let's talk about the progress that UHC has made and how satisfied you may be with it.
Okay, thank you very much. I wish to once again greet everyone who's listening, everyone who has joined us on the show, and to say I'm always happy to share information and to provide responses to the public. And the Universal Health Coverage Program is one which is very dear to me, dear to the government of St. Lucia, and it's very important because it is one of our manifesto promises. We know that a lot of work was done over the last few decades on universal health coverage. A lot of work was done by a number of professionals, going way back to the 1980s, the 1990s.
Right.
I mean, even earlier in the 1970s. It is always the dream. It has always been the dream of professionals in health, and also, I dare say, a number of administrations, political administrations, to have a health coverage system which would cover individuals in St. Lucia, which would cause them to spend less out of pocket. We know that St. Lucians spend over 40% out of pocket for health services, meaning that they have to spend over 40% of their own money directly to cover their health. And we know that health insurance is not, everyone does not have health insurance, and we do have health insurance packages at various workplaces and so on, certain government departments and unions, but it is not for everybody. It's not everybody in St. Lucia who has health insurance. So St. Lucia does not have a system where every single St. Lucian is covered by a particular system or particular plan. This means that a number of people in St. Lucia either delay health services for themselves because they cannot afford to pay, or they do not go for early diagnostic services because, again, they have to find the money. We know that this system cannot remain because proper health care is important not only for the lives of individuals and families, but it's also important for the economy. If you do not have a system where individuals can take care of their health, it is bad for the family, for you personally, but the economy suffers. So this is kind of very important for the government. We know that the Ministry of Health continues. They've always had primary services at the primary level, meaning the health centers. We've had a very good system over the years of primary healthcare services, and we knew that we needed to ensure that we caused universal health coverage to impact the primary sector. So we said what we're going to do is to have universal health coverage in a phased way. We also knew that over the last few decades, different governments have tried to implement some kind of system of universal health coverage, but it has been challenging. The Labour Party government under Dr. Kenny Anthony started the investigation of diabetes and hypertension. They started with medication to diabetics. Right. And the hope was that we would move into some sort of universal health coverage or national insurance with the NIC as a big partner. This fell apart because, as I've always said, elections have consequences. Dr. Anthony lost the elections. This system was not continued. We came back in government and tried to continue. We lost again. So there's been an on and off, starts and stops when it comes to universal health coverage. We came into government this time and we said, we know that the system is challenging. You need to, first of all, you must have a sustainable means of financing universal health coverage. And if you don't do that, even though you start some programs, if you don't have the sustainable program, the sustainable financing mechanism, it is going to be challenged in the long run. But we said we are not waiting for the sustainable financing mechanism before we begin to offer services. And that is the approach that we have taken. So while we are working on the structure, the sustainable financing methodologies, we are providing services through the Universal Health Coverage Unit, which is headed by Dr. Eugene. And this unit works with our primary care system. So this unit works with the nurses at the wellness centers, you know, our CNO, our PNO, Principal Nursing Officer, Chief Nursing Officer, our CMO, and the other departments the other units in the ministry to ensure that we deliver services. And what we can say is that so far, over the last 2 years, over the last year and a half, we have delivered concrete services, and services we can quantify the services. We know how many individuals have received maternal and child care services. We know how many individuals have received cervical cancer screening using the updated method of liquid-based cytology. We can quantify the number of training sessions we've had. Right. We can quantify the number of nurses and the number of healthcare workers who have received additional training. So what the satisfaction for me is that we have started to impact our St. Lucian residents, our St. Lucians. We have started to impact fellow St. Lucians in a phased way with the Universal Health Coverage Program, even while we use the expertise of professionals, both at the World Bank and WHO and PAHO, also our local professionals, people with consultancy firms. So we are working on the financing, but at the same time, we are delivering to thousands of St. Lucians. We are delivering new services and additional services. That is what the satisfaction is all about. But we are not satisfied because we know we have a lot more to do.
Okay, that's fantastic. Thank you for that update. And it is really good knowing that the minister is quite satisfied with the progress made so far, but you're also looking forward to what is to come. I know that our devout listeners and many St. Lucians are quite aware of the services under UHC. And that would be maternal and child health services. This is where you get the lab services as well as your ultrasounds at no cost to you. So you would get one ultrasound per trimester. So that's a total of 3 ultrasounds throughout your pregnancy at no cost, as well as your labs. And then recently, they also introduced the cervical cancer and HPV screening, which is also important. Some people would say, why not concentrate on another package? For example, another type of cancer. How would you explain to the masses the method that the Ministry of Health has taken to select the phases in which UHC is rolled out?
Okay, we first of all, you need to look at the data. You need to look at the various ailments that affect St. Lucians. You need to look at the mortality, and you need to also match that with your capability to adequately cover the service. So while we want to do everything all at once, we know that in the past, governments have had this hope of doing everything. They've had the hope of having all of the services in one basket, what we call an essential package of services. And different governments have been working at that. And what I realize is governments have hoped that they had the money in the past to do everything all at once. And the evidence shows that we've never been able to provide these services except for free medication to diabetics. Right. There have been other basic services at our primary care, at the health centers. For many of the services, St. Lucians do not pay for many of the services, but there are a number of services where you pay some money for at the primary centers, even now. So what we are trying to do is to use statistics, use data coming out of the Ministry of Health to decide which service we are going to put on board that affects people, that creates mortality, problems with our people are dying. We saw cancers, for example, very, very significant. Diabetes, hypertension. If you look at the PBF program, which is connected to UHC and eventually will be subsumed into the whole UHC program, we decided to target issues, or let us call it that, health issues that impact the mortality rate in St. Lucia. The health issues that cause the most problems, the health issues that cause the death of more people in St. Lucia. So we're looking at non-communicable impacts of non-communicable diseases. You have your hypertension, you have your diabetes, you have cancers, lifestyle diseases, and so on. And when we look at the cancers, we look at cervical cancer. We see, for example, prostate cancer is a big problem, and therefore we are going to put on board diagnostics, early detection for prostate cancer. Okay. And people may ask, why maternal and childcare services? The thing about it is, this is where it all begins. This is where it all begins, pregnancies. And if we can cause our pregnancies to be safer, if we can cause our ladies who are pregnant to have all of the tests, all of the ultrasounds, if we can detect problems early enough, and if we can guide them even more during the pregnancy, then eventually we are going to have a healthier baby. Right. And if we have healthier children, we are already starting off at where we should really begin. So it is really a scientific approach. knowing that there are lots of things we need to do. There are lots of things we need to do. We need to take care of a lot of ailments. But the thing about it is we have to be realistic. We must do what we can afford to do and what we can learn from. So the maternal and child care services, for example, we have had experiences where we work with the private sector. So we want to be sure that we if we make mistakes, we record it, we learn from it, and we add it to our experiences. So as we develop the universal health coverage program, we are less likely to mess it up, so to speak. We are less likely to make mistakes as we go along. So that is what, for me, it's been a learning experience for us. And if we've been successful with the maternal and child care services, we have seen where we need to improve certain things, whether it be informing people of things or the areas where we do the services, where we need to improve the conditions at the wellness centers. All of these things will help us eventually with universal health coverage, because we are not just coming with a one basket of services and trying to implement everything one time without the proper financing and without the proper arrangements. So what is happening here in St. Lucia is that we've taken a phased approach and we are building on every phase. In other words, we are trying to develop an essential package of health services. It's like you go to the supermarket. You want to buy groceries, you want to buy fruits, but you can't pay for everything all at once. So you have a basket, you add in one, then you add in another, you add in another, you add in another. Eventually you'll learn the lessons, and then we are going to have a proper universal health coverage program with proper financing.
And you're learning as well, because those countries that would have introduced, have a more holistic approach to UHC have had to pull back. So I think that it's also important not to introduce too many or everything at once and then have to go back to the public and say, well, we need to pull this one back and that one back because there isn't adequate financing or, adequate staffing, because it does put a strain on the service providers as well, on the doctors and the nurses. Another thing that we wanted to touch on, and I know that a lot of people want to hear about St. Jude, but just to touch on at the stadium where the hospital is currently located, the staff at St. Jude issued a press release earlier this week where they spoke about the assistance that the government of St. Lucia is rendering, and that comes in the form of more aid in terms of nurses and doctors, more beds, more opportunities for testing, so that they can indeed provide that level of care that is so desperately needed at St. Jude. But what UHC also does, Minister, and correct me if I'm wrong, isn't it to encourage people to use the primary care centers as well, because there are 37 wellness centers on island and many of them are underutilized. Was that part of the plan as well, to steer some of the individuals? Because, if anything is wrong, we run to the hospital, but there are wellness centers that can care for, areas in which that wouldn't necessarily just put a strain on the hospital.
Okay, very good. First of all, the aim of universal health coverage is to ensure that individuals, St. Lucians, first of all, get better access to health care. The access should be increased. So there are more opportunities for St. Lucians to get access to good quality health care. The second objective is that they will get that access at a lower out-of-pocket cost. It doesn't mean that there may not be times when you'll have to pay something, but the cost over time will be less to you. And also, the quality needs to be, in other words, we will continue to increase the quality of healthcare. Now, our objective is to ensure that more St. Lucians use the wellness centers. And again, our work is evidence-based. So, we have recorded, for example, in some cases, over 60% of individuals and even more using the wellness centers as a result of our universal health coverage program. And that is very important to us. Because when St. Lucians go to the wellness center, a number of things happen. you are seen by trained professionals, but you also interact with the primary healthcare system at the wellness centers, at the GIPC, at Soufre, at Denry Hospital. You interact with the primary healthcare system. When you go to these centers, information is placed into what we call SLUIS, which is the health information system. And so when you're weight and so on, the basic information, and you will, if you go, for example, to Vieux-Fort, then tomorrow you live at Grosile, you go to Grosile, your information is in the healthcare system, is in SLUIS, and therefore health professionals can access your information when you visit them at any other wellness center. So the Universal Health Coverage Program, it encourages you to go to the wellness center, to use the services of the wellness center, and to encourage you to go to the wellness center often. So you do not wait when you have a serious problem to rush to the hospital. I mean, if there's an emergency, obviously you have to go to the hospital. But if your relationship with the wellness center is developed, the wellness center in your area, if you're going to the wellness center, check your pressure, check your sugar, and so on a regular basis, or as often as your doctor recommends, then we believe we will have, not we believe, the evidence suggests that we will have less problems with kidney failure, we'll have less problems with heart failure, less problems with, problems relating to hypertension, problems relating to diabetes, because most of our deaths in St. Lucia are related to lifestyle diseases. Most of our deaths are related to problems with heart sickness, problems with your heart, problems with your blood pressure, problems with diabetes, your kidneys, and so on. Most of your problems are related to diabetes, high blood pressure, which leads to kidney failure and so many others. So the Universal Health Coverage System is trying to popularize, so to speak, the access by St. Lucians to access to the health centers, which is where the primary care system is. And hopefully, by the time we are completed with our basket of services, and more and more individuals continue to use the primary health services, we will hopefully see less pressure being placed on the hospitals. And I want you to understand the relationship between the NCDs, problems with diabetes, problems with high blood pressure, and the hospitals. You might ask, why is the relationship between these and the emergency room at the hospital? I will tell you. What the hospitals are saying to us, the professionals at the hospitals are saying to us, that over the last few years, over the last 10 years, over the last 7, 8 years or so, what we are seeing is an increase in the number of St. Lucians who go to the emergency rooms, not only because of violence. Yes, we have an increase in gun violence and so on, but also because of an increase in the impacts of non-communicable diseases. So more individuals are going to the emergency rooms because of high blood pressure, because of the impacts of diabetes, because of those kinds of things. And we have more pressure on the emergency rooms, emergency departments of both the St. Jude Hospital and also the Owen King AO Hospital. That is, so if we can control at the primary care level, if we can control a lot of these pressures, okay, if we can control that, we're not going to have the additional pressure at the hospitals. So our aim, we are hoping that we will catch a lot of the problems earlier. So if St. Lucians are going to the primary care facilities, listening, paying attention to what the doctors and the nurses, the trained and qualified nurses at the wellness centers, it is less likely that they will find them, that we will find ourselves in the emergency room at the hospitals. And over time, this means that we are going to free up, so to speak, the hospitals for greater emergencies that really need the attention of the doctors and the nurses. Because when we have emergency departments of both St. Jude and OKEU filled with those kinds of ailments, and then you have an accident or you have a mass casualty situation, then the resources at the hospital come under a lot of pressure.
Yeah.
So hopefully the Universal Health Coverage Program, it has already started doing that. And hopefully as we expand it, we will see more people using the primary care centers. We have already seen an increase, as I've said, in some cases, 60% increase, over 50% increase. We see over 1,700 individuals in the maternal and child care going to get their services. And we are seeing an increase in the numbers of ladies who access the cervical cancer services. And you know, it is growing at a phenomenal rate. And I'm satisfied with the progress of the Universal Health Coverage Program. And I really want to thank all of the professionals, the nurses at the wellness centers, the health aides, and everyone who, you know, you should go around to see how everyone is working together to ensure that that the programs succeed.
I know that the program is coming to an end. Unfortunately, we only have half an hour. I do want you to just touch on St. Jude very briefly. However, we do have like a couple of minutes I think we can play with. And I did want you to speak on prostate cancer. We do have prostate cancer screening, a specific day for the gentlemen to come into the wellness centers and get that test done, have their screening done. But it would be a word of encouragement from you. I believe that is something that we'll have to record and send out to them, or perhaps you can always welcome to come on the show anytime that you need to, Minister. But quickly on St. Jude, we saw that a little over a month ago, the government of St. Lucia entered into their contract, or signed the contract with the Saudi Development Fund. How is the construction going so far? I know that it's all systems go down there. Of course, we have to always understand that some people may feel sensitive about the subject. Of course they would. It's been so many years. How confident are you in the delivery of St. Jude to the people of St. Lucia?
Well, I must thank first of all the staff of the St. Jude Hospital at the stadium for, you know, their continued sacrifice, and also the St. Lucians who access services at the stadium. We have said time and time again that the hospital should not have been at the stadium, and if it was there because of an emergency, by now the hospital should have moved. I don't want to go into all of the reasons today, but I just want to tell you that my comments, I try my very best to always base my comments on evidence, and the evidence shows that the work at the St. Jude Hospital site at Auger, that work is moving very quickly, and most of the major work is done, meaning the major work in terms of major construction, most of that is done, and the contractors are now working on what I term the finer aspects of the work, meaning work like tiling, doing the finishing. Some of that will take time, but they've also procured the system of the process of procurement for medical equipment has started. So we should have the new medical equipment on island not too long from now. The procurement process has started, and also the last set of contracts have been signed to do work on things like tiling and the floors and that kind of thing. So I'm very confident that in the next few months, at some point in 2025, in the next few months, everything should be completed. We are very confident, as we've said, that the St. Jude Hospital will be moved before the term of the government. I'm hoping that it is not too long from now. We keep saying to St. Lucians we're not coming up with an exact date, but we are very confident that we are moving to the site at Auger not too long from now. We are confident because we have the financing, we have a contractor, an experienced contractor, and we have seen for ourselves the progress of the work. I also want to say that the St. Jude Hospital administration, together with other partners, are working on the commissioning, and we are hoping with the training that is happening. We noticed in the last couple of days there was a training program with Accreditation Canada. And as we've said before, healthcare services is not just about the buildings. The buildings are very important, but the healthcare services have a lot to do with training of your professional staff and retraining and training of new staff and so on. And it has to do with standards also. And standards should not be just St. Lucian standards. As far as possible, there should be standards that are world class. And Accreditation Canada is helping the St. Jude Hospital and also the Owen King EU Hospital to ensure that we get to those standards. So I want to say to you that we are very confident about the progress at the St. Jude Hospital at Auger. And it will be a glorious day when we move the patients and staff to the site at Auger. Very quickly, you spoke about prostate cancer. And again, we have added prostate cancer diagnosis to our universal health coverage delivery program. And very soon, the ministry will announce the arrangements for prostate cancer for prostate cancer diagnosis. And I want to encourage all men of a particular age, in the early 40s, even some in their late 30s, to please go out there to do your prostate cancer screening. We have a large percentage of our men who die every year from prostate cancer, and it is because, and the doctors say to us all the time, it is because most men go in to get that test too late. By the time you go in, doctors tell you are at stage 3 and so on and so on. But prostate cancer can be dealt with if it is caught early. The doctors say so all the time, just like cervical cancer. So for me, it is to encourage men to go out there and to get your prostate screened. The Ministry of Health will make the announcements, and it is another benefit of the Universal Health Coverage Program that we are rolling out. It's another benefit of the Universal Health Care Program. You'll be able to do your prostate exams even more regularly at the wellness centers. Some of it is already being done, but we are going to expand it, and we are going to ensure that that the different kinds of tests can be done at the wellness center. So, and again, I mean, we can't say that too often, that men, it is tradition. People say so all the time, that men don't like to go to doctors. It is something we have to change. It is a kind of conversation we have to change, to say, men, let us love doctors and go to your doctor as early as possible. I just want to say to you that I do a prostate cancer screening test every year. Many men are afraid of digital prostate examination. They say to you, no doctor will push their finger inside of me. Well, I do one every year. I mean, I do one every year, and I always love to say that as minister, that to encourage other men who are my friends and men who are in the community. I mean, I do the digital exam, I do the blood test, your PSA, and also there is the ultrasound that I do. It's available, and the Ministry of Health will be making it available even more widely in the community, and we want to encourage men. Too many of our men die of prostate cancer in St. Lucia.
Okay. Thank you so much, Minister, for accommodating us this morning. I would like to say a special thank you to everybody who tuned in via Facebook, television, and radio. We do have quite a few comments that we cannot get through today because we have gone over time, and I know that there's other programming that's scheduled to commence. But we do thank you for being here today. I think that you shed a lot of light on the various packages under UHC, the plans of the government, the policy decisions, and as well you touched on the St. Jude Hospital reconstruction project, as well as the St. Jude Hospital where it is situated now at the George Odlum Stadium. We know that there are many plans of the government of St. Lucia. We understand that these plans take time to execute, but it is something to talk about when you see progress happening. And I think it is important to always come in and report back to the public via whatever means necessary, whether it be through this show, the Facebook page, through town hall meetings, press releases, just to let people know what is going on, because there is always something going on. And I do believe that this is a government of transparency, and it is important to keep that going. So thank you again.
Well, thanks very much. Very happy to be here.
Great. And this has been PHI. Do join us next week, where we will be discussing exclusively the St. Jude Hospital reconstruction project. We will have our lines open then in the final 10 minutes of the show. We begin every Wednesday at 9:30 a.m. until 10 a.m. right here on MBC Television and Real FM. I'm Jade Brown. Thank you for joining us.